Hey there, Employee Assistance Program professionals. My name is Jody Kahn. I'm here to talk to you today about opioid misuse disorder. You might be seeing a lot of your employees that you're working with suffer from this. It's a very common issue in today's world. First off, what are opioid medications? They're traditionally prescribed by physicians or other healthcare providers for acute or chronic pain. You generally hear about them being prescribed after a surgery or for people that have cancer. They're monitored and regulated by the DEA, and there's different levels of how stringently they're controlled. There's classes 1 through 5, 1 being illegal drugs like marijuana, LSD, ecstasy, heroin, all the way to level 5, which are some medications that help with things like irritable bowel disorder and some other type of issues like that. The most common controlled medications are Schedule 2 and 3, and those are your oxycodone or your hydrocodone, and we see a lot of those medications being prescribed today. According to Hoffman, over 2.1 million Americans are suffering from opioid abuse disorder. Well, how does that even get started? Where a lot of people get prescribed the medication and find that once they start taking it, they like the way it makes them feel. And from there, they start to abuse the medication and start to have issues. And from there, they begin to divert the medication, buy it illegally. That's when you hear about people dying from overdoses when they begin to buy it on the streets. They're getting medications that are laced with fentanyl, which could potentially lead to death. And that's why we're here. We're here to talk about what are some ways that we can help people help them stop the prescription abuse and the opioid abuse disorder. The most common methods for dealing with this have previously been just cold turkey, just stop taking the drug altogether. But the problem is that with these medications, they have tremendous withdrawal effects, pain, stomach issues, nauseous, sleeping issues, irritability, depression, cravings that become so bad that the person can't deal with them and go back to using. Some people have used traditional rehab facilities to try to come off of drugs, which have proved to not be that effective. There's groups of people that think that 12-step groups, such as Narcotics Anonymous or Alcoholics Anonymous, can be helpful. And while they are helpful, they do not have an outstanding rate of where people sticking with the program. There tends to be a lot of recidivism, people going back out and using. Most commonly these days, the most helpful and the best way to combat opioid use disorder is with medication-assisted treatment. And what that looks like is doctors or other healthcare providers are prescribing methadone, or what's really been more popular these days and more successful has been Suboxone, which is a combination drug that has part buprenorphine, which is an opioid antagonist, along with Narcan. So that way the person can take the drug, which helps with cravings of the opioids, but it also has Narcan in it. So that way if they try to take another opioid, it prevents them from having any type of effect. So that with counseling, which is where you guys come in with the employee assistance program, you guys can work with these people who's having their medications managed by professionals, and you can offer them counseling on what are the root issues and how they even got started with the opioid abuse. Now, what we're offering is a new approach with using cognitive behavioral therapy. Now, this has been found to be a lot more successful. Sokol in 2018 wrote that many people feel that opioid abuse disorder is a moral failing, and when it's not. And with medication associated treatment combined with cognitive behavioral therapy, will allow for a more successful chance of full recovery. This will help your employees gain control of their lives instead of ended up in this vicious cycle of returning to the opioid medications, then stopping, then having a relapse, and then ended back on the medications. What our company is offering is trained cognitive behavioral therapies. We're offering that to many different employee assistance programs out there, and this would be, you can either come on board with us for a weekend where we come to you and spend a Saturday and Sunday going over the basics of cognitive behavioral therapy, or you can use our online option where you can get the training at whatever time works best for you. So again, the two options are the weekend model, or like we said, the online model where you work at your own time and pace. So again, we just want to reiterate what we're offering is cognitive behavioral therapy, and we feel like this in combination with the medication assistance treatment, this gives your employees the best chance for a meaningful and successful recovery. Thank you for your time, and if you have any questions, just feel free to reach out and let me know how we can be of any service. Thank you.